Hello, my name is Scott Perry, and I'm the head of neurosciences. I'm the director of the Genetic Epilepsy Clinic at Cook Children's in Fort Worth, Texas. And I'm going to cover seizure triggers and vaccinations in Dravet syndrome. Now, we know that common triggers for seizures in many people with epilepsy, but particularly in Dravet syndrome, are things like fever or modest elevated temperature. So think about going outside on a hot day, or maybe taking a hot bath, for example, can lower the seizure threshold and trigger seizures in this population. In addition, we see it with other common things like illness, obviously illness associated with fever, or just an afebrile illness. Sleep deprivation. Sometimes we hear reports of overactivity, things of that nature can bring about a lowered seizure threshold in people with Dravet syndrome. With that being said, one of the most common things people have concern about are vaccinations, because there could be fever associated with vaccines, and what should the routine vaccination recommendations be. And it's agreed upon that persons with Dravet syndrome should certainly receive all routine vaccinations. There's a strong consensus among physicians and moderate consensus among caregivers in the 2022 consensus statement that an annual influenza or flu and an annual COVID-19 vaccine would be recommended. There are potentially some steps we can take to decrease the likelihood of fever with vaccinations and, of course, provoking seizures. The main thing being using antipyretics, so medications to decrease the chance of fever, like ibuprofen or acetaminophen, for example. Some people will use other medications, for instance, benzodiazepines like clonazepam, during the day of vaccinations and the days following, which might be helpful. There was not consensus on that practice, but some people certainly do that, and so it should be considered. But the main takeaway is that routine vaccinations are certainly recommended for people with Dravet syndrome. Thank you.